Good morning, everyone. Thank you for joining Parks and Recreation Ontario from Regulations to Reality, the third in our series of webinars focused on the Ontario pool regulations and changes that are happening in the aquatic industry in Ontario. I'd like to welcome our presenters today, Michael Shane from the Life Saving Society and Chris Wagg from the Ottawa Drowning Prevention Coalition. So here's our agenda for today. Hopefully we'll be able to get through this agenda in good time and get you back on with your day. We're going to begin with a few review of scenarios and issues that have been brought forward by Red Cross, who contributed to the development of this content today but are unable to join us. We'll be looking at some scenarios, especially regarding supervision. We'll have an opportunity for you to bring forward your issues. We will be talking about changes to certification that are coming. As well, as I said, we will preview the Delegate Knowledge Exchange, Managing Risk with the Drowning Prevention Coalition. That's a new feature that's happening on Thursday at the Pro Aquatics Conference. So with that, I'm going to hand things over and be joined by Michael Shane from Life Saving Society. We're going to focus today on the regulations about supervision because there's been some confusion and there's charts in the regulation and that seem to not be clear or as clear as they used to be. So this is just taken directly from the new pool regulations, Ontario Reg 565, and it specifically says that a public pool is exempt from safety supervision requirements of subsections 2, 3, and 21 if an operator ensures there's adequate supervision is provided during the period when the pool is being used solely by one or more groups, each not exceeding 25 in number, for aquatic instruction, practice, competition, or display under direct supervision of a certified aquatic instructor or coach, and other such requirements as listed here. So this is always one of the challenges that owner-operators face is that when they rent out facilities, that they're unclear on what kind of lifeguards they may require on site, if the coaches are certified, what certifications apply. So we're going to go to interpretation and discussion. I'll hand it over to Michael right now. Mike, if you want to make sure you're unmuted.
I am.
You're perfect. All right. Sorry, I moved for you.
Yeah. Thanks, Diane, and thank you for everyone for joining this morning. Diane's right. This is an area within the regulation that even after 3 months is surfacing a lot of questions for owner-operators in particular, and even at the regional health unit, they're having difficulty interpreting this section of the regulation. I think it really focuses around two issues, and one being the designation of coach and what awards are being recognized by the Ministry of Health, and two, because of the removal from the old regulation of lifeguard as an instructor award, many owner-operators and especially swim teams are faced with a challenge to operate their facilities. So as we know that in an instructional environment, operators are exempt from providing lifeguards as per the chart that we've all grown accustomed to using, the 1 to 30 and 31 to 125 chart. Providing the instructor is certified as an instructor and is 16 years of age and also holds a lifeguard or assistant lifeguard award. The focus of the confusion comes in the area of where the instructor and coach does not hold a lifeguard or assistant lifeguard award. And the provision in the regulation is that if that is the case, then that there must be a lifeguard on the deck to provide supervision of that class. It's not explicit in the regulation, but it's our interpretation to mean that if that coach does not hold an assistant lifeguard or lifeguard certificate, and then of course there must be a lifeguard on deck to provide that supervision. And so I think that's where some of the confusion is raised. We've attempted to try and clarify this with the ministry, and we'll continue to seek some guidance in that area. But I think in the short run, I think owner-operators are choosing this route of instructor-coach with a lifeguard designation.
Great, thanks. So here's a scenario that you might encounter in your facility. You've rented out the facility to a swim team. They have 75 swimmers, and as per the regulation, they have 3 head coaches that meet the certification requirements and are over 16 years of age. However, they routinely break into smaller groups of less than 25 and who work with assistant coaches who may be as young as 13 and may or may not have the formal coaching certificates required. So what do you do in this case? I hand it back to Mike.
This is a pretty common occurrence. It's almost in a way a bit of a trick question because I'm sure most of you have noted the 75 number and 3 coaches. But some of you have also noticed the stipulation of an assistant coach. This is on the deck. So if we're to hold true to the letter of the law, because there are 76 bathers, because even this uncertified individual who's assisting on the deck ends up being a bather in the count, there must be an additional certified coach / lifeguard, assistant lifeguard on deck to provide supervision of this group. More likely there would be 74 people in the water and 1 person on the deck. And I think in public pools in Ontario this is a fairly common practice of coaches focusing attention perhaps on 1 or 2 individuals and trying at the same time to maintain supervision of all individuals in the pool. Even though they choose to operate in this manner, they are still responsible for all bathers in the pool that they've been designated. So those 25 swimmers are their responsibility no matter what they are doing. We know that coaches and instructors must obtain certain certifications in the regulation. Those that do not meet those are considered bathers. We know that we have released in our guide the stipulation that NCCP certifications count as an instructor certification. So those would be certainly recognized. And if they, certainly those coaches don't have a lifeguard or assistant lifeguard certification, then additional supervision would have to be provided in the way of lifeguards. But again, going back to the point here, and that is that dependent on the number of people in the pool and the number of coaches on the deck, whenever you've been assigned, the 25, the 15, the 10, they are your responsibility to maintain supervision of while they're in the pool, no matter what activities you have them doing in the swimming pool.
Thanks. Thank you. And I think, would you add that as, owner-operators who are renting out our facilities, it's really incumbent upon the owner-operator to ensure that those that we rent to are following the guidelines and the regulations as well. And the more we can share that information with our stakeholders, the better off we are, so that there's no surprises and no issues that arise through rentals of facilities. So the next one is a pretty simple one. Again, I don't think we're trying to trick anybody here, but private training partners offering lessons to families in a backyard pool. They've created the opportunity for their 16-year-old child to do this as a summer job. They hold the correct certifications, but it's out of date. So I think this is pretty straightforward, and I'll let Michael respond to that.
Yeah, I agree, Diane, because this is a private pool setting. In Ontario, Regulation 565 has no authority in private pool settings, so owners of private pools can choose to follow any standards they wish. There are exceptions, of course, for condominium, apartment, hotel pools that meet the requirements in regulation based on size, number of bathers, etc. But for the most part, I think we can say that in Ontario, private pool owners are exempt from the requirements of Regulation 565. The only province in Canada where I'm aware of private swimming pool regulations is in the province of Quebec. But here in Ontario, this regulation does not apply.
And you do bring up a good point about the sort of the Class B pool, and just reminding people that there is the opportunity for Class B pools to operate as a Class A if they meet all the requirements of circulation and supervision and all the rest. And I know both Lifesaving and Red Cross have strongly recommended that their stakeholders have adequate signage as to when a lifeguard would or would not be on duty. We've got just a couple of questions. So before we move on to the next scenario, I'm just going to lob them back into the, this is going back to rentals or facility use by swim clubs and others. Joey has asked, is there any language that these people need to be trained in emergency procedures annually within the regulation? Michael, do you know?
Diane, I'd have to look carefully through the regulation for that. I believe there is a requirement for operators to receive training. There are some stipulations, but with regards to emergency procedures specifically, I'm not certain, and I would have to take a close look inside the regulation to find that.
Yeah, so Joey, we'll get back to you on that. I agree. I don't think I've ever seen that, and certainly in other organizations, other sectors, however, not specifically related to aquatics, but for example, in fitness and other certified industries, that's an optional, and it's a guideline. It's not within the regulation. They feel that the 2-year training provided by having your certification renewed every 2 years as lifeguard or assistant lifeguard may cover it, but we'll double check and get back to you. And then Kate has asked, what if offering publicly available training in a private pool? So that's the class, Michael, I guess that's a Class B designation then?
No, I don't believe that would even fall under the auspices of Class B. I think because this is in someone's backyard, that no matter who you invite into the pool, it would not be considered a public pool. Of course, there are many other things that pop into my mind about hosting such activities in your own backyard swimming pool, and insurance is one of them. Establishing some minimum standards, and you might turn to the Lifesaving Society's backyard pool safety guidelines as a minimum standard, but the regulation would still not apply in a private setting, even if you were inviting kids from the neighborhood. Doesn't mean to say
or charging, right? Yeah.
Right. Doesn't mean to say that as responsible owner-operators, you might choose to follow the regulation, the standard of 565. It would be a very prudent thing to do, but you're not required to follow that, in my opinion.
It speaks to standard of care and what is generally accepted as a certification within the public realm could be held to a standard in the private sector as well, outside of regulation. So, and there's always joint and several liability issues, although in a private pool, I think that a municipality is then protected from joint and several because the municipality has no part in ensuring that the lessons or whatever activities taking place there is under their jurisdiction. But good questions. All right, I think this is our final scenario before we head off. A pool operator wants to offer swim instruction and lap during the same time period. So this is similar to our first scenario. 4 lanes of the pool will be used for swim instruction and 2 will be open for lap swim. All of the aquatic instructors hold a lifeguard certificate within 2 years and are 16 years of age, so we know they are compliant there. The 5 instructors are each responsible for a group of 8 to 10 swimmers, and it is not expected there will be more than 5 or 6 lap swimmers. Over to you, Michael.
Yeah, so do they require a lifeguard? Yes, is the answer. This is a shared activity program going on inside the pool where there are lessons occurring and what we would call a recreational swim. Instructors cannot be responsible for maintaining supervision of those participating in a recreational swim, and so I think it's quite common practice to do this, and owner-operators, of course, choose to place lifeguards on the deck to supervise the recreational swimmers while the certified instructors / lifeguard assistant lifeguards provide instruction to the kids in the other 4 lanes.
Great. So I think, just to wrap up this section, we will be having an opportunity for you participants to ask your questions or pose some things that are working. I think what we are interested in is maybe impact on operations, decisions that you have or discussions you've had with your local health inspector, things like that. But we'll just spend a couple more minutes talking about the lifeguard and assistant lifeguard standard and what's new in that area. And back over to Michael.
Yeah, certainly, Diane, we've seen the challenge that owner-operators faced over the past 3 months. We know that the ministry is also facing the same challenges of educating well over 600 public health inspectors in Ontario. Now, thankfully, they all have a copy of our Guide to Public Pool Regulations in their hands, which I think is helping. But I know training continues in that area, and I think as we continue along, we'll see certainly compliance or a standard emerge. Some time ago, the ministry approached the Society and Red Cross to discuss the drafting of standards for assistant lifeguard and lifeguard status. At that time that they approached us, we had requested that stakeholders, owner-operators, be invited to participate, but we were asked to keep this confidential and within the 2 agencies. So I'm glad to finally let everyone know that a standard has been created. It took several months for us to come to this standard. It was submitted to the ministry in August as our joint position on the standards for assistant lifeguard and lifeguard, and is currently being reviewed by the ministry. This was important to do because you, owner-operators, had requested that we come up with one standard for the province of Ontario, and so we did that. It's now important that the ministry puts this in place when evaluating other submissions for equivalency status, as we expect there will be 10, 20 other providers as the years go by in Ontario. And I think as long as they're all teaching the same thing, content's all the same, and the candidate walks out with the same skills and knowledge, you as our owner-operators will be happy. We don't know where that is at the moment, but we should emphasize that the content is similar to the previous provincial standard that we had in regulation, in that it will remain at 16 years of age. The prerequisites will be similar, and the content of both lifeguard and assistant lifeguard will be similar to the previous provincial standard. We're now waiting and eager to assist the ministry on the whole implementation side of this down the road, and well, we'll just wait. As most of you know, Tony Almafa, who was the lead on this, retired. He's yet to be replaced, and so for the moment, we haven't heard of any changes, but we're eager to move forward with this.
Thank you. We will be reaching out to the ministry in advance of the conference to understand if they have any update, but we did invite them to participate, and because of the change in government, they were not allowed to travel to meetings. They have to get apparently the news is they actually have to get authorization even to participate in in meetings with stakeholders on the telephone. So we don't know if they will be able to send any news, but I know that both Red Cross and Life Saving Society are on their their top stakeholder list, and will be informed as things move forward. So how is it going to affect you? Obviously, current certifications issued are still valid. Other organizations, as Michael said, maybe 10 to 20 could be recognized. I think, Michael, am I correct in remembering that the YMCA is also mentioned in the regulation as a valid certification, or is that not true?
The stipulation in the regulation actually doesn't list certifications.
Okay.
It just says lifeguard certificate, but the ministry and the society has recognized Red Cross, Life Saving Society, YMCA, and that's it at the moment.
Right. Thank you. I knew I had seen it somewhere. So yeah. So that's if there's anybody from the Y who is on the phone, those certifications stand, and we'll be having a discussion of this and the impact of this at the Pro Aquatics conference if we have any more information to share at that time. So right now we're just going to open it up to the floor again. What's working, what's not, anything that you have a burning issue that you would like to share, you can just type it into the chat box, and we have a few people typing in. And if we find that this is still an issue, we will be bringing forward these kinds of issues to the conference to be discussed at our industry update Thursday at lunch. I'll just wait while people finish typing their questions. And thank you for the great overview, Michael. As always, you are clear, concise, and font of all knowledge. I know how complicated regulations are, and I know how much all of the people on the call have worked also to implement them properly, but I know that you've been a great resource to so many.
Thanks, Diane. And I should correct myself. The two certifications recognized currently in REG are Life Saving and Red Cross.
Okay.
Those are the two currently recognized.
Okay, great. So Kate's question is, what about the coroner's recommendation on supervision ratios, which are quoted by public health inspectors on admission? Are they the same as the regulations? Great question. Yeah,
the current admission standard in the issued by the society since 1996 stands as the ratios that the ministry has supported. So the ratios of 2 to 1 for kids under 6, kids between 6 and 9 is 4 to 1, and kids over 10 come on in and have fun. There is no supervision required. Of course, we know that with life jackets for those kids between 6 and 9, the ratio can go to 8 to 1. And those ratios are laid out inside our guide and remain as the standard that the ministry has accepted.
Great, thank you. I think it is so, it's so great that the sector could come together and have a unified position on these issues, because we've seen in other areas of risk management and injury prevention that there are a lot of decisions that are not made on evidence. And I think it would stress that our work with with Red Cross and Life Saving has always been founded on research and on the statistics and information that help make evidence-informed choices. All right, still a couple of people typing.
Yeah, you've got to remember, too, that the ministry was actually helping us promote that same standard for the past 5 years. And, in fact, many health units went out and asked owner-operators to publish signage. And so it's good that that was done, and we continue to support that. I've done a little checking through the regulation while we've been chatting, and Joey, I can't find anything in here with regards to emergency procedure training annually that is required stipulated in the regulation.
So Kate's question is that the inspector is holding to the coroner's recommendation, and do they have the authority to force this issue as it is more stringent than the regulation? And I'll defer to Michael on this.
Well, the coroner's recommendation is the same recommendation that we've been promoting since 1996. So I'm glad to hear public health inspectors are asking you to adhere to that standard. As we know, the stipulation in the regulation for the admission standard is unclear, incomplete. And so the requirements that Dr. Evans came up with in 2000 after the St. Albans drowning is the same one that we've been promoting since that time, and in fact prior to that drowning at St. Albans. So I would continue to support that, and I'm glad to hear they're doing that.
Yeah, I think on the webinar that the Ministry of Health and Long-Term Care hosted with a couple of inspectors, yes, they have the latitude to exceed the regulation. Should they feel it is warranted within the type of facility or whatever, there is that latitude. And so, I think if there are specific things, you can bring them forward to the ministry. The ministry has an information line, and that it can be brought forward to the standards area for the public health. We have a question from Bruce Parkin. I think there are a few people who might be typing in response to that. We'll get back to it. We have a question from Bruce Parkin about alkalinity. And many facilities are struggling to maintain alkalinity in Waterloo-Wellington region. And are there steps that we could take as a region, or at least organizations, to work with our local health units for any type of exemptions? And I think this came up on our last call as well, Michael. What have you heard in the field?
Yeah, there are areas within our province that trying to maintain an alkalinity reading within the parameters of the regulation are very difficult. In fact, the source water probably comes out at around 200 parts per million. So trying to bring it down to the requirements of the regulation, in and around the 100 level, the 120 level, is extremely difficult. They're struggling. And I think what I've heard from the ministry is that from a regional point of view, they're willing to work with owner-operators because they're, certainly aware of these issues in their communities. So, yes, I would continue to work with their regional health units. They do have some latitude to allow variance, but it is a good point that we need to work with the ministry and seek some clarification as to where this number came from, and although they likely would point to the Model Aquatic Health Code. But are there other methods that we can suggest to help with this problem, or are there other levels that might be permitted that will ensure safe water?
That's a great point. It is, one of the approaches that PRO took with the child care regulations was to form a working group and ask the ministry to meet regularly with stakeholders in a very collegial and a collaborative manner to bring, so that the sector could bring forward the issues and they could be addressed, and so that we could hear directly their position, where they're going with that, and that we could communicate it back. So that's something that we'd be approaching the ministry to see if that's a good way to work with this, so that it's not, so that we are ensuring that all stakeholders' voices are heard. I know there was certainly throughout the consultation period the recognition that municipalities needed to be brought into this conversation at some point, and that the Class B operators as well need to sort of have a voice as well. So that's something that we would be recommending as we move forward. So Joey's asked another question. Can you comment? I assume this is related back to the assistant lifeguard and lifeguard standard. Can you comment on the detail in the language for that will be or equivalent? Will it be just high level with item titles or detailed down to must-sees? I'm not quite following your train of thought here, Joey, but maybe Michael is understanding how and when do we see the detail coming out? Well, that's a good question. Or will we just know that there is an agency is approved or not? So, okay, I get the question now. So Joey's asking is, as an employer, would I be able to see the details of Diane's swim school certification, or would I just know that she is approved? I'm assuming that that's where we're going with this. And Michael, do we have any details on that yet?
Joey's got a number of questions in here. Certainly, with regards to the language that we've given the ministry, it's detailed items, knowledge, skill items, and items that would help us evaluate as a pass or a fail. So very detailed, not high level, very detailed items. Some items you would probably see in an award guide, similar sort of format. How and when is this detail coming out, and how you will know about it once it's come out, I have no idea. Those are the questions that still need to be asked and some discussion that still has to occur. So answering part one, yes. Part two, I don't know, Joey.
Thank you, says Joey. All right, I'm going to move on. We have the opportunity, if you think of more questions, if you have more things you want to ask, please put them in the chat box as we're going along. But I want to make sure that we get through our presentation today. So I just have one more slide before I hand things over to Chris Wagg. A time for a shameless promo. The Pro Aquatics Conference and Trade Show is coming up in November. We are so pleased, as always, to be partnering with Life Saving Society and Red Cross on content. And we have a fantastic program lined up this year. Just to speak directly, we've got 2 health inspectors doing a presentation. It's a great chance to buttonhole them. One's from the City of Toronto, and I think the other one is from Niagara Region Public Health. There's a couple of sessions using technology to minimize incidents, social media, drowning prevention. I think we're going to talk about that even today, and we have some great keynote speakers. Judith is from Summit, New Jersey, and then we have Doug Whitaker and Craig Book talking a couple of times, doing a session and a keynote. So early bird ends October 16th. If you want to save money on your registration, do that, and you can find the information on the Pro website. All right, so now I welcome Chris Wagg, who's in Ottawa, and Chris is the host for the first ever Pro Delegate Knowledge Exchange at the Pro Aquatics Conference, Saving Lives Through Grassroots Drowning Prevention Intervention. So it's a Let's Talk session. So we wanted to provide you, our stakeholders, with a little kind of a teaser about what we'll be talking about and get you prepared to come to that session and give your input. So I hand it over to you, Chris.
Thanks, Diane. Thanks, everybody, for joining in. So I'm going to give some background to the Ottawa Drowning Prevention Coalition just to start off. We've been in existence for about 12 years, and I've been there for about 10. Been lots of evolutions over the last 10 years to get to where we are today. Near the end of the presentation, I'll get into the details of who our stakeholders are. But the reasons why we're having local drowning prevention coalitions really being a force now in Canada is that in 2014, the World Health Organization produced its first report on the drowning epidemic. And this was really important to have the World Health Organization behind us. And their catchphrase was, "We need to immunize children against drowning." So in the report, there were 10 key steps to reduce the drowning burden. And think of this as a worldwide look at the drowning burden. So a lot of this we're already familiar with. So installing barriers, providing safe places, teaching school children how to swim, training bystanders, strengthen public awareness, set and enforce safe boating, manage floods, coordinate drowning prevention efforts with those of other sectors and agencies, which is the formation of coalitions, develop a national water safety plan, and address priority research. So within the community coalitions, the idea is that there's strength in numbers, and we invite stakeholders from a variety of like-minded partners. Some of those that we've targeted are those who work in the industry, so people like us who are pool operators, people within the society and Red Cross, civic engagement, so public voice, emergency services. With Ottawa, we have the injury prevention staff from the Ottawa Hospital, as well as CHEO, which is the Children's Hospital of Eastern Ontario. We have members from Ottawa Public Health. So what we'd like to do in this session upcoming at the conference is talk about who you would invite in your community, because we all come from different areas. So I have invited two people from very different areas to talk about their coalition. So Christine Mitchell, if you wouldn't mind stepping in and just talk about who you've invited and what you've done with your alliance.
Yeah, so we currently have a lot of passionate people on our Simcoe-Muskoka Drowning Prevention Alliance. So we have representatives from the fire department, Simcoe Paramedic Services, the health unit in both Orillia and Wasaga Beach. And we also have a few municipal representatives, some YMCA representatives. So it's great because everybody is so passionate about drowning prevention.
And your civic engagement is a woman whose child drowned at Wasaga Beach?
Yeah, so she hasn't made it to any of our meetings yet, and she's going through a little bit of a rough time, but she did unfortunately have her son drown a couple of years ago at Wasaga Beach.
Yeah, so that's the civic engagement. So having that voice is really important. Robin, if you wouldn't mind stepping in and telling us what you're doing out in Newfoundland.
Robin, I think you're muted your phone. I'm going to unmute you here. No, you are unmuted. Do you want to try again? We are not hearing you, Robin.
Okay, well, maybe I'll just give a little bit of background from what I know. So Robin's from Newfoundland, and what she's just recently done is started her own drowning prevention coalition out in Newfoundland. So she's had her first stakeholders meeting. So she had a few people on the call. Unfortunately, I couldn't chime in, but I will be on the next call just to try and help them through that process. So that's really great that she's starting that out in Newfoundland. So just to go back to the number 9 from the World Health Organization is the development of a national drowning plan. So Dr. Steve Bierman is co-chairing the Canadian Drowning Prevention Coalition. And with that, over the last week, just getting ready to release our third annual report. And in that report, we do have our 8 key target groups updating us on where they are with their each steering committee. So just to refresh, in that coalition within Canada, we've identified children ages 1 to 4, Indigenous people, drowning in supervised settings, new Canadians, Northern Canada, rural areas, and cold water submersion, unintentional falls into water, water transport-related drownings, and young adult males. So each of these groups do have a lead, except the Indigenous people. We're having some problems getting a lead in that area. Just with we found that the Indigenous people do realize there's a drowning problem, but they're dealing with many other higher priorities within their group. So we're just patiently waiting and continuing to try to meet with people. Steve and Lisa have come to Ottawa and met with some leaders, and they've recognized our group and have identified that this is a priority. We just haven't found a lead yet. So within your communities.
That's great. Chris,
Yeah, go ahead.
Sorry, Chris, I was just going to ask a question. Sorry, I should have typed it in the box. It's Diane English. You know, the duty to consult with Indigenous populations is kind of hitting the news just recently, and I think it's really important to note that it does take time to build those relationships, and I really applaud you for making the effort to do it, because I think, you know, it's important, in finding the right person can take that time. And so if you have any more insights to share, that's something that we might be able to get into at the conference. So thanks. That's all I want to say.
Great point, Diane. And within the Indigenous people, we have First Nations, and we have Inuit, and we have Métis. So they are really like to be identified as three separate entities, not as one entity. So all within that, there's different needs across Canada within the Indigenous population. So we're working away, but definitely that's going to be one of the target groups that we're going to be hoping to get some discussion about at the conference. So when you're thinking of the World Health Organization, they've given us the parameters, and then we've got the Canadian Coalition identifying. And we did this process of finding the 8 target groups by putting out surveys and asking people to identify their top 3 or 4 priorities within their regions. And those were how we came about with those 8 target groups. So now dialing it down even closer is identifying who's drowning in your community. We've struggled with this in Ottawa with, you know, we're always trying to get media attention. We're always trying to find a voice. We've had some great civic engagement with my dentist. We have an annual backyard launch at her place, and she at one point came to me and said, you know, I bought a house with a backyard pool and I don't know how to swim. And I said, well, this is a problem. So, you know, she got in there, she learned how to swim. She had a CPR party. She got all her friends together, learned how to do CPR. She put in the 4-sided fencing. So she's a real great leader in the community to show what's the great thing to do. But what we found in Ottawa, and the media have said this to us, is we're repeating the same great news over and over, which is good. But fortunately in Ottawa, we didn't have any backyard pool drownings this year. Whereas we thought, we just had our last meeting and decided who is drowning in our community. And we were looking at the baby boomers who are having medical emergencies, or people swimming in Class B pools at hotels and resorts. So our next event that we're going to plan is actually here at a condominium pool, where we're going to be talking to the media about those instances. So what's really important for you is to look at who's drowning, because it'll be very different for Newfoundland, and it'll be very different for Simcoe, and it will be very different for Ottawa. So how do you find out who's drowning in your community? There's obviously the drowning report, which we put out in Ontario, but you can find out through hospitals. So we're fortunate to have all of our hospitals on board with our coalition, so we get statistics from them. We have our local police. You can look at media that's been happening, and Barb with the Life Saving Societies always has great statistics that can help you guide your conversations within your community. So some of the barriers that we're going to be facing, that we've faced here in Ottawa, is it can be very political. So when I come to the coalition, I don't wear my City of Ottawa hat, I wear my life-saving hat, because it's much easier for me to speak freely without worrying about corporate communications, getting involved. And I'm sure a lot of us have those challenges with our municipal employers. People finding time, employer support, money, and also with egos, because everybody, you know, wants to have their name on a banner, and we've had challenges with that, and I'll be showing you our banner later and how we've branded ourselves. Christine, maybe can you talk about some of the barriers that you've faced?
Yeah, I would say they're pretty much the same. The big one is being people's time and the support from their employers. Some places have great support from their employers and some places do not, and they have to volunteer their time to come. But it's a great initiative. Also, we went from having kind of in-person meetings quarterly to doing conference calls quarterly, and then we meet in person at least twice a year. So it's just a transition and a different way of doing things, and you're going to have to figure out what works for your community and your community members.
Great, thank you. So one of the things that the Ottawa Coalition has really worked hard on is branding ourselves so that we are the recognized go-to people for information. So when you're setting out to create a coalition or an alliance, is to name yourself. And that way people can identify you. Christine, at the conference, I'm going to ask Christine to help me on the presentation to show the branding, because she's just recently branded her alliance and got some sandwich boards and things to put up at events, which is really great, because once people start seeing you, then they understand, oh, these are the people with the right messaging, and they're the leaders in the community, the go-to people. The other thing that we found is really important is just get in front of the camera or find somebody who will. A lot of people aren't really comfortable talking to the media, but it is really important to get yourself out there and find the time to get in front of the camera. Barb at the office, often she'll get a call and say, well, is there somebody that can talk in Ottawa? And she'll call me and I'll get in touch with the media. So Barb often gets calls. So it'd be great to have leaders out in the community that have a coalition that would be willing to speak. Robin just typed in that she's going to a rural school to talk about cold water and the impacts thereof. 2 years ago, that particular school had one fatality and one near miss when it came to students skipping ice pans. So that's a great outreach. So you have identified an incident that happened in your area, and then you're actively going out and doing some education. So that's great follow-up. So this is the banner for the Ottawa Drowning Prevention Coalition. Of course, in Ottawa, we're very bilingual. So this banner was designed with the help of one of the Ottawa paramedics who on the side does photography and graphic design. So we provided him with all of our logos, and he designed this banner for us. So it's really great to have all our partners. We did recently just get the National Capital Commission on board, but I did not have the latest banner when I put this together, but they're on board. And again, providing as much photo ops. So this was at one of our events where all of our coalition, the Ottawa Beach staff that were there, we try and bring mascots and showcase emergency vehicles to give the media photo ops, because that's really important. Again, having emergency services, and Christine, I know you mentioned this as well, they're a real great showcase. You know, me with my life-saving badge on and talking about drowning prevention, I can deliver the messaging, but what the media really enjoys is the photo op. And having emergency services and talking about what's available to the public and what the Ottawa Police or Fire do on our rivers or lakes is great as well. And I see Jennifer.
Yeah, I find they really draw in the crowd.
Yeah, there's something about a badge that does that for sure. So Jennifer just noted that you also started a coalition. That's great. So over in Niagara, and you have police, fire, public health, hydro, great. YMCA and the municipalities. So yes, Andre's been helping you out. That's great. And Red Cross and Life Saving are represented too, which is great. That's super. I'd love to sit down and chat with you, Jennifer. So as well, what we really try and do is get out to as many community events as possible. So here's Andre with the paramedics who just stopped into an adult learning graduation class. And we found that adult learners Many of them new Canadians learning a new language are very hungry for information, so getting out to those events as well. And Joey's asking if we have engagement from politics on the municipal level, and yes, we do. We just got our mayor of Ottawa to declare Drowning Prevention Week last year, so that was great. But our deputy mayor, Mark Taylor, has always been a huge supporter of us, and his daughter is a lifeguard, so he always comes out to our events and speaks. And what's great about him, and as well Matt Fleury, who is also a city councillor, past lifeguard, is they have many followers on their Facebook and their Twitter. So when they're tweeting out, they're always sharing our tweets and joining in on our Facebook and liking our things. So that's really important to have political support. And again, this was at one of our events, and this is great for media, that you provide photo ops. So when you're planning events, make sure that you have something there that they can take photos of. And social media. At the conference, Megan will also be presenting with me a whole segment on how to do social media, how to, how to work your Facebook, your Instagram, and your Twitter. In Ottawa here, we have our Ottawa area group. We have Ottawa Lifesaving page. We have an Ottawa Drowning Prevention page. We have an Ott Lifesaving Instagram. And I have my Ott Lifesaving Twitter account, as well as the Ottawa Drowning Prevention Coalition Twitter account. So going back to the branding, it's really important if you're getting your stakeholders together, naming yourself, and then getting out onto social media and seeing if you can secure any of those on social media, which is really great because it helps in sharing your information. So the way that we do it here in Ottawa with Facebook, that's really where we put our news out. Twitter as well is where our news goes, and then with the Ott Lifesaving Instagram is where we just showcase all of our local lifeguards doing different activities. So we try and hit all the different groups in there. So Robin had just sent me a note. I think we've covered all of your notes. Is there any other questions regarding the coalition?
I'll just jump in. Thank you so much, Chris, for this great overview. I hope it's given people an idea of some of the questions they might have and a dialogue we might want to have. I think, Joey, you hit on a really important point, is that the political engagement, and in terms of barriers, you can have politicians and people in the community on your side, but you might not have your direct supervisor on your side or the rest of your organization. So I think we'd be looking for some of those ways that we can prove and show the impact of these, and working with EMS and how these coalitions really do support drowning prevention and make the community a safer place and make our whole jobs easier. And to Robin, I just want to know what skipping ice pants is, but maybe you can just put that in the chat box. I have no idea. And Robin also had a longer post here about some of the partners that they have. It's great to see that they have provincial and federal government representatives on. I know that's sometimes a challenge in larger centers to get that kind of political buy-in, and certainly in right now in our political climate in Ontario, it can be a real challenge, and we have municipal elections coming up in a little while. So certainly I wanted to say that that this is going to be a great session at the conference and an opportunity for delegates to really share. Okay, so when the ice breaks and the kids hop from one to another. Okay, thanks, Robin. That's what ice pan skipping. I had visions of something sliding across the ice like a curling or something. So, wow, that looked dangerous. But a traditional Newfoundland and Labrador. All right, Joey's typing, and if anyone else has anything they want to share or any questions, I encourage you to put them in the chat box, and if we can't get to them all today, we will get back to you individually.
Yeah, Joey, I was talking to Judith about the 24-hour relay and how you had so many different partners there helping out. Those are the kind of events that I'm going to try and get out in that larger session in pro, because we're all doing stuff in our community, we're all working really hard, we all have the same passion for drowning prevention. It's just we're hoping to get together and share ideas and help people who are having struggles, getting a group together and naming themselves, trying to get some of those ideas shared. Thank you.
That's great. Thank you, Joey. And just as a note, Pro is putting together a webinar called Recreation 101, and it's aimed at new or returning counselors. And so we'll be looking for input from stakeholders, and we would specifically like some input from our aquatic stakeholders about the importance of aquatics, of the importance of drowning prevention in communities, so that we can share that with council so that they're aware of what their opportunities are to support our sector and what they should be doing more of in their communities. So look for some engagement on that in the weeks to come as we put that webinar together. It will be free for Pro members to download for their counselors. So I'll just ask one more time if anyone has any questions for Chris or for Michael. Both great presentations today. I'm just scrolling up. Michael did answer a question regarding signage, and we will be sending that around the chat as well as the presentation so that people can see the responses to that. And just a big thank you again to our presenters, Chris Wagg, Christine Mitchell, Robin, sorry we didn't hear you, but great typing, and Michael Shane. As we know, Michael and Christine will be presenting at the conference, and sorry, Chris, I'm calling Chris Christine, and maybe Christine Mitchell is doing a session too. I'm not sure. But here are the details on registering for the Pro Aquatics Conference, or if you want to reach out to any of us at any time, please feel free to do so through our emails here. And with that, I am going to close off our webinar and thank everyone for attending and wish you all a fantastic Thursday.
Thank you, Diane.
Thanks from Newfoundland. We see it. All right. Bye-bye, everybody.
The host has left the meeting. So at this time, the meeting will come to